I went to Warsaw recently to meet with a group of physicians from Ukraine and also from the Republic of Georgia, a neighboring country in that region. The medical community in Ukraine is treating many soldiers coming back from the front lines. They're working with patients within their communities who are under a high degree of stress. And one very unfortunate outcome of that, among other things, is that smoking rates have stagnated or actually getting worse among many portions of the population there. But these physicians recognize that this behavior is so lethal and will have very long-term repercussions. And that includes for young people, for youth in their country, that it is worth their time, even now, to devote themselves to do whatever they can to educate the medical community, their fellow physicians and nurses and other healthcare professionals, that in part based on the history of other wars over the 20th century in particular, that much of the lasting harm that results over the subsequent years involves the chronic use of cigarettes and other behaviors that will stay with the people that took on those behaviors at the time of war. So in Warsaw, I met with physicians who had taken the overnight train from Kiev and other cities within Ukraine to meet to talk about and how best to assist people in quitting smoking, and in some cases, helping transition them to far less hazardous forms of nicotine delivery, because it's going to have such a long-term impact on their society.